Imagine this. You're maybe managing a chronic health condition, right? But instead of constantly juggling appointments, tracking symptoms in some old notebook, your health data just flows effortlessly
Right.
from maybe a discrete wearable straight to your care team.
Right.
And an alert only goes off when something actually needs attention. Yeah. And you're, empowered to manage your health right from home. Or maybe you need like hospital level care, but you're getting it surrounded by family in your own living room.
That's the vision.
This isn't just some sci-fi dream. It's this quiet revolution happening behind the scenes in healthcare.
Yeah.
It's way beyond just a single app or, a fitness tracker. Today, on the deep dive, we're taking a deep dive into digital health technologies, DHTs.
DHT, yeah.
But we're looking beyond just the individual gadgets. We're talking about something really transformative. How these technologies are evolving into these powerful, interconnected suites of tools.
It's the core idea.
Yeah, and we're drawing on some fascinating insights from leading research, including this pivotal paper from Seoul National University Bundang Hospital. It really highlights the critical need for new regulation, new reimbursement models for these flexible groupings of tech.
It absolutely does. The current systems aren't quite built for it.
So let's really dig into this. We're talking about a future where healthcare isn't just supported by technology, but actively delivered through these smart, dynamic combinations of it.
Exactly. Delivered through it.
Our mission today is to really understand what that looks like. The immense potential it holds, highly customized care, safer home-based options, truly empowering patients.
Making them active participants.
Exactly. Active participants in their own health. And crucially, we'll explore the significant, sometimes unexpected challenges we're facing in making this incredible vision a widespread reality. Because it's not simple.
No, not at all. And when we talk about digital health technologies, these DHTs, it covers a really broad spectrum.
Right.
Think wearables like smartwatches, mobile health or mHealth apps on your phone, those big health IT systems.
Okay.
Telehealth platforms connecting you remotely with doctors, even tools for personalized medicine. It's a lot.
It's a huge umbrella.
It is. And there's this clear, accelerating global trend towards using them more in medical practice. The goal is to meet societal needs, things we couldn't address before, and, make healthcare more affordable, more sustainable. It's genuinely an exciting time.
It feels like we've been hearing about individual health apps and wearables for ages now. But the source material, it really points to something more complex, this emerging idea of grouping.
Grouping.
You have individual DHTs, maybe they've got their own regulatory approval already, but now they're being bundled into these suites to do completely new aggregated clinical tasks. What's the big shift there?
That's the key distinction, and it's pretty profound. These aren't just like collections of tools sitting side by side.
Right, not just a toolkit.
No, they're designed to interact in complex ways. And the real complexity within these suites means they can deliver entirely new ways of providing medical treatment, things we just couldn't do before with one single device.
Okay, new paradigms.
Exactly. But, and this is really crucial, because of these interactions, they can also produce unexpected. Well, the source calls them emergent actions or properties.
Emergent properties, what does that mean exactly?
It means the whole system, the suite, can behave in ways that none of the individual components were programmed or expected to. It's not just about minor glitches.
Ah, okay. So the sum is different than its parts,
Yeah.
potentially in unpredictable ways.
Precisely. And that fundamentally changes how we have to think about safety, about testing. You're no longer just approving a single device. You're trying to approve this dynamic, sometimes unpredictable digital ecosystem. It's constantly interacting.
That's a powerful idea. Okay, give us some tangible real-world examples. How are these DHT groupings actually being used right now to create these new paradigms?
Okay, well, let's think about monitoring chronically ill patients at home.
Right.
You can group together remote sensors, passive ones like smart patches, active ones like maybe smart scales,
Right.
with automated monitoring platforms, sophisticated alarm systems that ping caregivers if needed, and of course, teleconsultation platforms for virtual doctor visits.
Yeah, it's a whole package.
It's a whole suite, working together, monitoring patients in their own homes, which, is a genuine game changer for quality of life, for accessibility.
Absolutely.
And these groupings also enable what's known as hospital-at-home programs,
A hospital at home. Yeah, I heard of that.
allowing patients to get acute hospital-level care but outside the traditional hospital walls.
Wow.
And they can even improve efficiency in traditional hospitals or care homes just by automating routine monitoring tasks.
And it goes even further. I think I read about smart clinics. What does a smart clinic even look like with this tech?
Precisely. Imagine a smart clinic where, well, a lot of the physical exam can actually happen remotely.
Really?
A clinician conducts a comprehensive exam using an mHealth platform, right?
Yeah.
But they're using wireless tools like smart thermometers, digital stethoscopes that transmit heart sounds,
Okay.
otoscopes for looking in ears, even laryngoscopes for throat exams. And maybe the patient or their family operates these tools at home, and the data just streams seamlessly back to the clinician.
So bringing the clinic to the patient.
Exactly. Not always the other way around. What's truly fascinating here, I think, is we're moving beyond one device doing one thing.
Yeah.
We're moving to these complex integrated ecosystems, data flows, devices dynamically depend on each other. It's just a monumental leap forward for how and where care can actually be delivered. It offers convenience, potentially better outcomes too.
That sounds incredibly sophisticated and, frankly, a bit mind-bending. But haven't doctors always kind of grouped devices? I mean, like an orthopedic surgeon's instrument tray.
Mm-hmm.
All the tools for a specific procedure put together, sterilized. Is this really that different from what we've done for decades?
Mm-hmm. That's a great question, and it really gets to the core of the distinction the source material is highlighting. On one level, yes, grouping separate medical devices, sometimes from different manufacturers, it's a long-standing practice.
Right.
Your example of the orthopedic surgeon's instruments, often bundled as procedure packs, is spot on. And those physical groupings were sometimes even regulated together as a single unit. So the active grouping isn't brand new.
Okay, so what is the fundamental difference then? Because it feels like these DHT suites are just in a completely different league compared to a tray of scalpels.
They absolutely are.
Yeah.
The key difference, the really critical one, is that DHT aggregations are networked, interconnected devices.
How does it work today?
They have complex data flows between them. And crucially, this creates dynamic dependencies between the components.
Dynamic dependencies, meaning what?
Meaning, imagine a chain reaction. What one sensor picks up might immediately influence how another device in the suite behaves, or what alert gets triggered. It creates this continuous, potentially intelligent loop.
I see. It's not just static tools sitting there.
Exactly. It's not just a physical grouping in a sterile tray. It's a digital, intelligent, often self-optimizing network. And while, many of these suites still rely heavily on healthcare staff for operation, there's very realistic potential for a shift towards much greater automation down the line, where these suites become aggregated super devices operating with perhaps limited human intervention, working almost autonomously.
Okay, here's where it gets really interesting. So it's not just putting devices in a tray anymore. It's like imagining a symphony of tech, all working together, learning from each other, constantly adapting.
That's a good analogy.
As you hear this, you, the listener, might be picturing how this just completely rewrites the script for how we've traditionally thought about healthcare. And a perfect illustration of this is that hospital-at-home concept you mentioned earlier. How does that actually work in practice?
The hospital-at-home or HOSIO concept is, a perfect illustration of how these group DHTs are evolving in action.
Yeah.
Typically, an HAH suite involves a collection of things. Aggregated health sensors, robust alert systems, maybe smart pill boxes tracking medication adherence, systems for continuous remote monitoring of vital signs, other parameters, and comprehensive remote digital patient support, often including virtual consultations. The whole point is to bring acute hospital-level care like managing pneumonia or congestive heart failure directly into the patient's home.
Without compromising safety or quality, presumably.
That's the goal, without compromising safety or quality.
So it's not a brand new idea, but it feels like the pandemic really kicked its adoption into high gear, didn't it?
That's precisely right. HA existed before COVID-19, sure. Some pioneering programs are already running.
Right.
But it gained significant, almost unprecedented global momentum during the pandemic. And that acceleration was largely because of temporary changes, temporary regulatory and reimbursement changes that allowed for much more flexibility.
Temporary changes. Okay.
Yeah, and they rapidly demonstrated the viability, the need for these group DHTs in a crisis situation.
Can you give us some specific examples, those policy shifts that allowed this massive expansion?
Certainly. In the U.S., for example, the Centers for Medicare and Medicaid Services, CMS, they allowed reimbursement for ADH care as a diagnosis-related group.
Okay, what does that mean practically?
It means they essentially bundled the entire cost of providing that hospital-level care at home into a single comprehensive payment. That was a huge administrative and financial step forward.
Big deal. Yeah.
And they also waived certain requirements for remote patient monitoring that were previously mandatory. So they effectively removed some major barriers. This acute HAH program started in 2019 has even been extended now through December 2024 to keep evaluating its benefits. The source calls it a pioneering step towards telehealth adoption.
Wow. Okay, and what about elsewhere, like the UK? Did they see similar shifts? Did they embrace HAH?
Yes, the UK also saw significant movement. Their National Institute for Health and Care Excellence, NICE, they provide national guidance supported the potential cost-effectiveness of HAH, or virtual wards, as they often call them.
Potential cost effectiveness. So not a full green light.
Well, it was in a 2023 early value assessment. This kind of conditional approval from NICE, it's actually quite well suited to the fast pace of digital innovation. It supported both the ability to safely generate more evidence and address unmet patient needs right away.
Makes sense.
However, NICE also pointed out some very significant assessment challenges that still remain.
Such as?
They noted insufficient prior data to draw really definitive conclusions. A lack of suitable comparators, how do you compare this to traditional care properly, complex interactions across different healthcare policies, variations in the standard of care region to region, and just general heterogeneity in how these programs were actually implemented. So the promise is clear, but that long-term evidence base, it's still being built.
Okay.
So if we connect this back to the bigger picture, the pandemic really truly accelerated the adoption of these grouped DHTs. It showed us what's possible under flexible rules, under urgent need, but that flexibility was, in many cases, temporary, which raises this big question about their long-term innovation. How do we get permanent, sustainable regulatory frameworks to catch up to this rapid innovation? It's this ongoing tension, you know? Innovation versus established practice.
That tension makes perfect sense.
Yeah.
So, okay, we have this incredible potential. We have real-world traction.
Yeah.
And what are the big hurdles still standing in the way? I imagine safety, how we regulate them, how we pay for them. That must be top of the list.
Absolutely. The biggest challenges are precisely there. First, safety and performance. It's incredibly complex.
How so?
When you group multiple DHTs, especially if you're combining, say, regulated medical devices with non-medical digital tech, like a proper heart monitor, with a consumer smartphone app, you get those network device interactions and the emergent system properties we talked about earlier.
Right, the unpredictable stuff.
Exactly. So ensuring seamless interoperability, confirming they work reliably together, making sure they're applicable across diverse patient groups.
Right.
It requires this thorough, meticulous examination of every single component, individually and as part of the whole system. It's like trying to predict how a whole ecosystem will behave, not just one organism.
And with everything connected, especially sensitive health data, cybersecurity must be a massive concern. The idea of a health system being vulnerable because of, I don't know, a smart pillbox is chilling.
It's not just a concern, it's critical. Cybersecurity for the individual parts and for the aggregated system, all those Internet of Medical Things devices, IoMT, the sensors, the monitors. It needs incredibly careful regulatory attention, especially for systems that become core clinical infrastructure, like in hospital at home. The risks could go way beyond just individual patient data breaches.
How far?
Potentially threatening the integrity, the operational continuity of entire healthcare systems, even national health services. Plus, remember, many DHTs are adaptive. They learn, they evolve through software updates, AI model training.
Right, they change over time.
Which means the device being regulated isn't static, it's a moving target. That adds yet another unprecedented layer of complexity to oversight to ensuring ongoing safety.
So what does all this mean for the innovators? The developers trying to bring these incredible, potentially life-changing technologies to market. It sounds like they might be running into just a formidable wall of bureaucracy, outdated regulations.
That's a very real concern, a significant bottleneck. Let's look at the EU's medical device regulations as an example.
Okay.
Their Article 22 basically says that commercial providers of systems combining medical devices and non-medical DHTs, they have to treat the entire package as a medical device for regulation.
The whole thing, even the non-medical parts.
Yes, which means the commercial provider has to risk assess all components, even parts they didn't make, and provide clinical data for the combination as a whole.
Wow. That sounds monumental, almost impossible. What if, say, a company makes a brilliant health app that uses the ECG sensor built into someone's regular commercial smartwatch?
Neat.
Is that app developer suddenly responsible for getting the smartwatch itself approved as a medical device, even though they didn't manufacture it?
That's precisely the practicality issue the source highlights. The interpretation of EU law could suggest that, yes, manufacturers using built-in smartphone or smartwatch parts might need MD approval for components they don't produce.
That seems incredibly impractical.
It is, especially given they aren't the manufacturer of those parts. The current guidance tries to clarify, but it effectively burdens app developers with assessing and providing evidence for every possible sensor configuration across countless smartphone brands and sensor types out there.
Just think about how many different phone models, different watch sensors exist globally.
It's an astronomical testing burden for one app developer.
Yeah.
So it raises this important question for regulators. Is it realistic? Can we really expect developers to anticipate and test for every possible scenario of interaction, every device combo, especially when flexibility and variability are kind of the whole point of these suites?
It feels like a major regulatory bottleneck.
It is. And if it's not addressed, it could seriously stifle the very innovation we need in digital health.
And then, okay, let's say you somehow manage to clear all those regulatory hurdles. There's still the money side of things.
Mm-hmm.
How do you assess value? How do you reimburse something so complex, so modular, so dynamically changing as these DHT suites? It can't be easy for traditional health systems.
You've absolutely hit on another critical challenge: reimbursement. It has its own unique complexities.
Like what?
Well, assessing cost effectiveness, gathering enough solid evidence for these big modular suites is incredibly difficult. Often there aren't good comparators.
Right. What do you compare it to?
Exactly. How do you compare a comprehensive hospital-at-home suite to traditional inpatient care when they offer such different experiences, maybe different kinds of outcomes? It makes it hard to benchmark their value definitively.
Yep.
Plus, just accurately estimating the initial investment needed for staff training, for integrating new digital infrastructure, for actually developing these complex systems. It can be really tough to nail down. It's a big ask for health systems used to discrete, defined procedures and billing codes.
So, to sort of bring this deep dive towards a close, it really sounds like the transformative power of digital health technologies isn't just about, the cool new wearable you strap on or that single app tracking your sleep.
No, not just that.
It's really about these novel, interconnected suites. They're creating entirely new, sometimes fuzzy, care networks that blur the lines between the clinic, the hospital, and your own home. It feels like a truly fundamental shift in how healthcare gets delivered.
Exactly. The source really emphasizes that. Much of the revolution will come from these intelligent aggregations, not just individual devices working in isolation. And regulators are recognizing this shift too. Yeah, for instance, the U.S. Center for Devices and Radiological Health, the CDRH, they're actively working on developing forward-thinking strategies, looking for a regulatory pathway that actually integrates this kind of thinking, that recognizes the unique nature of these bundled technologies.
And the pandemic, with those temporary rule changes, it really proved the concept, didn't it? Showed what was possible when the rules were maybe bent a little.
It absolutely did. And while those temporary adaptations served us incredibly well during that global crisis, there's this huge opportunity now that the immediate urgency has eased off a bit, an opportunity to explore whether entirely new, permanent frameworks, maybe even new paradigms, can be developed for these super complex, multi-device digital human workflows.
Interesting.
The authors of our source material even hint at a second article coming in their series, which will explore what those innovative new frameworks might actually include. So it's an exciting, definitely challenging frontier, one that's going to reshape healthcare for decades.
So as you, our listener, reflect on what we discussed today, maybe consider this provocative thought. How could this challenge, regulating and reimbursing these complex super devices, how could it fundamentally shift not just how we get healthcare, but maybe who is ultimately responsible for its safety and effectiveness?
That's a big question.
Does the responsibility, the onus, move more from the individual device maker towards the system integrator, the entity that actually pulls all these different technologies together into a working whole?
Yeah.
And what does that kind of profound shift mean for your trust as a patient? And what does it mean for the very pace of medical innovation in the years ahead? Something to think about.